This project is very important because we looked back at 2009 H1N1 pandemic and we learned a lot. We were very fortunate during 2009 that it wasn't more severe, but we can envision a much more severe pandemic where a lot of people were getting sick at the same time, flooding into hospitals and doctors' offices, and where there could be really long delays to see a provider. So the Nurse Triage Line has a number of capabilities. One is to give accurate and timely information to people who need it. Two, to listen to what people are suffering from and help them decide if they may or may not have influenza. And if they do, can they stay home and be treated at home, or do they need to go to a doctor's office or emergency room or a hospital? In addition, we're exploring whether the nurses who man the triage line can provide access to prescription medicine, antiviral medicine, and therefore sort of totally take the face-to-face contact with the system out of the picture.
I think truly the development of a national nurse triage line is just one more tool that we can add to our pandemic preparedness toolkit. Really, in the event of a pandemic, it will be an all-hands-on-deck approach. And this is one tool among many that will be very valuable for our practitioners and our healthcare assets in the event that a pandemic does hit.
From the rural perspective, we have limited resources both in public health and on the healthcare side. So putting together the national nurse triage line system would be a huge enhancement for our ability to respond to a pandemic, because it would give us the ability to leverage resources such as poison control centers or some other call center model that we wouldn't normally have access to.
Poison control centers provide free care to everybody 24/7 all over the country. They're staffed by nurses and pharmacists who are trained at talking to people on the telephone and finding out what they need and then directing them to the appropriate level of care. Those 211 operators can do a lot of help in giving that accurate information and relieving some of the stress on the medical care system.
I see the NTL project really being a great way for public health and public health ancillary type organizations to have stronger connections. A great example is the public health community is now working with 211 poison centers and nurse triage lines to really understand how they can all effectively work together to meet any kind of challenges that may be coming toward us related to public health emergencies. Well, I think it's important because we've seen just in our own nurse triage line working day to day that it's really a vital resource for people to get information, to quickly get assessed, to know what they need to do for their healthcare needs.
Healthcare assets are vulnerable to being overrun by an influx of patients. So the nurse triage line is one way to reduce the surge on the healthcare sector and allow for greater capacity to care for and provide information to people that are seeking information during the pandemic.
The nurse triage line is one way, and I think an excellent example of surge planning. It allows us to increase the capacity of traditional public health and serve a much broader population and allow for the traditional public health partners to serve those with the greatest need.
As we continued our planning efforts and then were confronted with H1N1, a real pandemic influenza outbreak, there was quick realization that local public health staffing and personnel would be overwhelmed in such an event. And at the time, given our phone line situation, 10 phone calls would have shut down our phone system. Who would answer the questions and take some of the surge off of hospital capacity by directing patients to the proper place?
The NTL line would actually relieve some of the burden placed on local health. We have minimal staff, especially nursing staff, and that would be a way that we can answer the response for the community. Anytime that you can treat someone over the phone and not have them come in for a visit and they get the same results, it's a win-win for everyone.
What I really see the NTL project being able to do is to be able to provide that information and triage to the public using telephones, something everyone has, and doing that well because that's what they do every day, providing that kind of telephone triage and really freeing up the local and state public health agencies to be dealing with the larger issues that are related to a pandemic. So it's really a great synergy, I think, with everyone doing what they do best.
The nurse triage line, it's something that it gives us the ability to access things that wouldn't normally be available to us in terms of a large call center or staffing that we wouldn't normally have. The beauty of this project is that it gives us small health departments, potentially staffing and technology that we wouldn't have.
In the United States, there are many nurse triage lines that function every day. They're part of hospital systems, healthcare systems, doctors' offices, and clinics. And those nurse triage lines work well, but they don't serve the whole population. So this project attempts to fill that gap by working with poison control centers and 211 information lines to provide nurse triage services to anyone who needs it.